We go now to the latest in the fight against the coronavirus. The 7-day U.S. average is below 30,000 new cases a day for the first time in nearly a year. That number is still high, but it's a sign that vaccines are working. Jamie Yuccas joins us with potentially more good news. Jamie, good morning. There's a vaccination study involving kids as young as 6 months old. What can you tell us about it?
Yeah, just little babies, Enrique. Good morning. 144 kids, 11 and younger, are now participating in Pfizer's clinical trial. It will eventually enroll more than 4,500 children with the goal of applying for emergency use authorization for kids' vaccines by the fall. The family we spoke to says it was eager for the opportunity and is encouraging others to sign up. For parents, Otavio and Zenaida Good, the first step to getting back out into the world was getting their family vaccinated. Their sons, 3-year-old Andel and 8-month-old Soren, were among the first kids under the age of 5 to receive the Pfizer vaccine. Zenaida, who has a PhD in immunology, felt confident about signing her kids up for the phase 1 clinical trial at Stanford.
What made you guys decide, no, we want to go ahead and do this?
Vaccines are one of the greatest inventions of immunology, and it's like the key for us to feel good and safe about our kids.
One thing that we're concerned with is the long-term effects of COVID, and it's like, yeah, we'll take the vaccine any day over the potential downsides of COVID.
Dr. Yvonne Maldonado is overseeing the trial, which will help researchers determine dosing. The goal is for kids to have a strong immune response with minimal side effects.
Children have a tendency to develop fevers more often than adults do in general. And we also know that children frequently respond to lower doses with good immune responses.
Zenaida says Andel and Soren were given 1/10 of an adult dose. And baby Soren returned last week to have his blood drawn.
Did your kids have any side effects?
Not anything major. Andel, after his first dose, he was a little bit low on energy for one day and had a sore arm for one day. But after second dose, both kids had nothing.
Maldonado says kids' side effects will likely be similar to adults, but it's a small price to pay.
COVID is the 10th most common cause of death in children in the U.S. right now. It is causing children to be sick with a disease for which we don't know the long-term effects.
For the Good family, shots also mean they're more comfortable at some of their favorite places, like the park.
What I really miss is going to the playground and meeting new families and making friends and coming back to our house and playing, you know. And
now we are happy to open up to the world again. Now we feel protected and we don't feel worried anymore. And it's a wonderful feeling.
Researchers will use blood work to determine how strong the vaccine response is at fending off the virus. If the children don't generate enough antibodies, they can return for a higher dosage.
Jamie, the CDC is flagging a new concern about vaccines and a rare heart condition in kids. What do we know about that?
Yeah, we're just learning about this. The CDC says it's investigating a small number of teens and young adults who developed the rare heart condition called myocarditis after being vaccinated. While the CDC did not specify how many people developed it, the agency says all appear to have mild symptoms, and there is no clear link between the vaccine and the condition. And the CDC guidance has not changed. It is encouraging everyone 12 and older to get vaccinated. Enrique?
Jamie, thank you.